Most people think heart disease starts with clogged arteries, high blood pressure, or cholesterol. But what if your risk was partly decided the day you were born by something you can't change but can learn to outsmart? The latest studies on blood type are rewriting decades of heart health advice, and what they reveal could save lives. Maybe yours, maybe someone you love. Hi, friends. It's Susan Miller, and today's conversation might just shift how you and your doctor look at heart health forever. I'm here with Dr. David Harper, cardiologist, researcher, and someone who's been following the newest data on how blood type plays into heart risk in seniors. But before we get into the science, let me tell you about Mary, one of our listeners from Ohio. She's 73, active, walks her dog every morning, no smoking history, no major heart trouble. She had her annual physical, numbers all looked decent, and 3 weeks later, she was in the ER with a heart attack. When her doctor reviewed everything afterward, one line in her records suddenly stood out: her blood type. That one detail completely reframed how they thought about her risk. And until that day, she had never heard it could matter. So, Dr. Harper, that's where I want to start. How can something so basic, so unchangeable, actually change the odds for seniors?
Susan, this is one of those areas where science has been whispering for years, but now it's starting to shout. Most people know their blood type because of a donation, a surgery, or a card they keep in their wallet. But research in the last decade, especially a large 2022 study published in Arteriosclerosis, Thrombosis, and Vascular Biology, is showing that certain blood types, particularly type A and type B, carry a measurably higher risk of blood clot-related heart events compared to type O. It's not just about cholesterol or lifestyle, it's about how your blood behaves on a microscopic level. People with non-O blood types have higher levels of a clotting protein called von Willebrand factor, or VWF. Higher VWF can make you more prone to clots that can block arteries in the heart or brain.
So, you're saying two people could live almost identical lifestyles, same diet, same exercise, and yet one might have a higher baseline risk just because of that one letter in their blood type?
Exactly. It's a hidden variable in the equation. And the problem is, most standard heart risk calculators your doctor uses, they don't include it. That's why Mary's case is so telling. Her cholesterol looked fine, her blood pressure was under control, but she had type A blood and elevated VWF levels. That combination made her more vulnerable, even without the usual warning signs.
I can imagine listeners thinking, okay, but I can't change my blood type, so what am I supposed to do with this information?
That's the key point. Your blood type isn't a verdict, it's a clue. If you know it, you can tailor your prevention plan. For example, if you're a senior with type A or B, you and your doctor might be more aggressive about screening for clot risk, monitoring inflammation markers, and managing other factors that interact with clotting, like atrial fibrillation or diabetes.
You're basically saying it's like finding out your house is on a floodplain. You don't move the house, but you do put in better drainage and keep an eye on the forecast.
Exactly. And the forecast here is your health profile over the next 5, 10, 15 years.
You mentioned that 2022 study. Were there others that made you sit up and say, okay, this is real. We can't ignore this anymore?
Yes, two in particular. A 2021 meta-analysis in Journal of the American Heart Association looked at over 1.3 million participants worldwide. It found that non-O blood types had a 9% higher risk of coronary heart disease and a 51% higher risk of venous thromboembolism, a serious blood clot condition, compared to type O.
And another from Harvard School of Public Health tracked nurses and male health professionals for decades. They found that people with type AB, the rarest type, had the highest risk for both heart disease and stroke. AB? That's what, only a few percent of the population?
About 4% in the US, but here's the thing. When you are in that group, the difference in lifetime risk can be significant enough to change how you and your doctor approach prevention.
So
For our listeners who are thinking, I haven't thought about my blood type in years, how do they even start? Do they just call their doctor's office?
That's one way. If you've ever had surgery, donated blood, or given birth, your medical record may already have it. You can also request a simple blood test, usually covered if there's a medical reason. And yes, this conversation is a medical reason.
I'm thinking of my neighbor, Frank. He's 76, just had a stent put in. He has no idea what his blood type is. He'd probably laugh and say, "What's it matter?" But clearly, it matters.
It does, and knowing opens the door to specific steps. But Susan, here's where it gets really interesting. Blood type doesn't just affect clotting. Some types are linked to how your immune system handles inflammation, how cholesterol particles behave, even how your gut bacteria interact with certain foods.
Wait, are you saying blood type could influence diet response?
Yes, but not in the way fad blood type diets claim. There's no magic menu for type A versus O. But studies, like one in Nutrients in 2020, showed differences in how certain types metabolize fats and sugars, which can interact with heart risk over time. And that's a whole conversation we can dig into, because the connection between your blood type, your gut health, and your arteries, that's where science is headed next.
Okay, you can't just drop that and move on. I think we've got every listener leaning forward right now. In just a moment, Dr. Harper is going to explain why your blood type might make you more sensitive to certain foods and how that sensitivity could quietly drive up your heart risk without you ever realizing it.
So here's the thing, Susan. Your blood type is defined by specific antigens or markers on the surface of your red blood cells. These antigens aren't just floating around doing nothing. They interact with your immune system. And your immune system, in turn, plays a huge role in how your body responds to inflammation and the foods you eat. For example, certain bacteria in your gut thrive better in people with type A or B antigens. That can subtly shift the balance of your gut microbiome, meaning the community of microbes in your digestive tract. And that balance can influence how your body processes fats, sugars, and even cholesterol particles.
So you're saying my gut bacteria could be working with or against my heart health just because of my blood type?
Exactly. Think of it as your body's operating system. If you have a version of that system that's more prone to inflammation, the same plate of food might cause a bigger spike in inflammatory markers for you than it does for someone else. Over years, that chronic low-grade inflammation can stiffen arteries and destabilize plaque.
That makes me think of all the times someone says, my friend eats the same thing I do and their cholesterol's fine. Why is mine high? And maybe the answer isn't just willpower or bad luck.
Exactly. And this isn't just theory. A 2019 study in Circulation found that non-O blood types tended to have higher LDL particle counts even when their total cholesterol numbers were similar to type O individuals. The particle size and density matter for plaque risk.
Dr. Harper, can I tell you something? My dad had a heart attack at 68, and we were all stunned because he wasn't overweight, didn't smoke, walked every day. I don't know his blood type, but now I'm wondering if it was part of the picture.
That's a common story. Family history and genetics absolutely overlap here. If you inherit a certain blood type and also inherit other genes that affect clotting or cholesterol, those risks can compound.
So if I'm a senior and I find out I have, say, type A, what's my first step to protect my heart?
Step 1, have a real conversation with your healthcare provider. Tell them you know your blood type and you're aware of the clotting and inflammation data. Ask whether it makes sense to check your von Willebrand factor, C-reactive protein, and advanced lipid panel. These tests give a deeper look than standard cholesterol checks.
And for those who feel like their doctor might just brush it off,
You can say, I understand blood type isn't in the standard guidelines yet, but I've read recent research linking non-O types to higher clot risk. Could we at least discuss whether advanced testing would be helpful for me? Framing it that way shows you're informed, not demanding, and it makes it easier for your doctor to consider it seriously.
I can already hear some listeners writing that down word for word.
And they should. Knowledge is power, but only if you use it in the room with your doctor.
You mentioned clotting and inflammation. I'm curious, how much of that risk can you actually dial down with lifestyle changes if you can't change your blood type?
Quite a bit. In fact, that's the encouraging part. A 2022 study in The Lancet showed that seniors with higher genetic clotting risk, including those with non-O blood types, could cut their risk by nearly 50% with a combination of regular exercise, anti-inflammatory diets, and proper management of blood pressure and diabetes.
So movement really does matter, even if the cards you were dealt aren't great.
Absolutely. Think of your blood as a river. If that river flows steadily and smoothly, clots are less likely to form. Exercise helps keep that flow healthy. And when you combine that with an eating pattern that reduces inflammation, more leafy greens, oily fish, nuts, less processed sugar, you change the terrain inside your arteries.
And you're not talking about a fad diet, right?
Not at all. This is about sustainable, balanced nutrition. One interesting finding from a 2020 European Journal of Clinical Nutrition study was that non-O blood types benefited significantly from higher intake of omega-3 fatty acids in terms of reducing clotting markers. So yes, simple choices like 2 servings of fatty fish a week could be a big deal.
That's surprisingly doable. But I know some listeners are wondering, what about medication? If I'm in a higher risk blood type, should I be on aspirin or something else just in case?
Great question, but that's a depends on the individual answer. Low-dose aspirin can help prevent clots, but it also raises bleeding risk, especially in older adults. That's why I recommend discussing it with your doctor in the context of your whole risk profile, not just blood type. In some cases, a blood thinner or cholesterol-lowering medication might be the better route.
You know, this conversation reminds me of something you said off air, that blood type research is like finding a new chapter in a book we thought we'd already finished reading.
Exactly. For decades, we focused on the same risk factors. Blood type was seen as interesting, but not practical. Now, with more data, it's moving into the actionable category. I think within the next 10 years, it'll be standard for heart risk assessment in seniors.
And here's the part that gives me chills. Some researchers are finding that blood type might not just influence whether you get heart disease, but when.
Yes, there's evidence from the Framingham Heart Study that certain non-O types tend to have cardiovascular events earlier, sometimes years earlier than O types with similar profiles. That means prevention needs to start sooner for those individuals.
That makes every listener's next doctor's appointment feel a little more urgent.
It should, because once you know, you can act. And in a moment, I want to share a case from my own practice. A patient whose heart attack risk dropped by more than 60% in 5 years, simply because we factored his blood type into his prevention plan.
All right, I'm hooked. Friends, stick with us because in just a moment, Dr. Harper is going to walk us through that story step by step and the one decision his patient made that every senior could start considering this week.
His name's Walter, 71 when he came to see me, retired postal worker, proud grandfather. He'd been told for years that his heart was fine because his cholesterol was only mildly elevated and his blood pressure was under control. But Walter had type AB blood. I ran a deeper panel, found elevated von Willebrand factor, high C-reactive protein, and small dense LDL particles. Individually, none of those screamed imminent danger, but together, plus his blood type, they painted a different picture.
So without looking up blood type, someone might have missed the whole story.
Exactly. Walter could have coasted for a few more years and then suddenly ended up in the ER. Instead, we put a tailored plan in place. Moderate dose statin, daily omega-3 supplements, added 25 minutes of brisk walking 5 days a week, and cut down on processed carbs. Within 2 years, his inflammation markers dropped by half. His LDL particle profile improved, and his clotting factor came back into the safe range. He's now 76, still walking, still coaching his grandson's Little League team.
That's the kind of story that makes me want every listener to pick up the phone and call their doctor today.
That's the goal. And here's the bigger point. Walter's plan wasn't extreme. It was consistent, informed by his individual biology, and monitored over time.
I think a lot of seniors hear new research and think it means complicated or risky. But this is about knowing yourself and making small, smart shifts.
Exactly. And for seniors worried their doctor will dismiss this, bring the research. Mention the 2022 Arteriosclerosis, Thrombosis, and Vascular Biology study. Mention the Journal of the American Heart Association meta-analysis. Say you've heard that certain blood types may have higher clot and heart risk, and ask if it's relevant to you.
You know, there's something empowering about realizing that even if you can't change your blood type, you can change how you live with it.
Absolutely. Think of it as a blueprint, not a prophecy.
Friends, if you take one thing from today, it's this. That little letter on your blood donor card might be more important than you think, and knowing it could give you the edge in protecting your heart.
And please, don't wait for symptoms. The first symptom of heart disease for too many people is the event itself. Find out your blood type, talk to your doctor, and start making those steady, healthy changes now.
All right, Dr. Harper, thank you for breaking this down so clearly. And to everyone listening, whether you're type O, A, B, or AB, remember that your heart health isn't fixed in stone. You have more power than you realize. Take a gentle walk after this episode, drink some water, jot down the questions you'll ask your doctor. And stay tuned, because next week, we're tackling the hidden signs of bone loss every senior needs to know. It might just save you from a fracture you never saw coming. Until then, I'm Susan Miller, and this has been your time to learn, breathe, and take the next small step toward a healthier future. Take care, friends.